Hi guys, welcome to our YouTube channel Nursing Update. Today we'll see about MCQs in Hematology and Immunology nursing. Okay, so it might be you people might be feeling like this as a less important topic, but if you see any question paper, you might have seen minimum 2 or 3 questions from this topic. Okay, there are chances that there won't be questions from neuro or some other medical surgical nursing, but there will be surely MCQ will come from hematology or immunology nursing part. Okay, let's move on to our today's video. Before going to that, if you are new to our channel, please subscribe our channel and press the bell icon. Okay, so first MCQ, after injecting mantosters, it will turn positive in. Options are 24 hours, 48 to 72 hours, after 5 days, and no response. What is Mantoux test? Why it is done? Mantoux tests are done to check whether the patient is getting infected or is having infection with TB or not. Okay, tuberculosis or not. Okay, so what we do, we take 0.1 ml of purified protein derivative of mycobacterium. Okay, then we inject intradermally. Okay, and we'll check the response in duration. Okay, we'll call as in duration, how well it is getting indurated, after how many hours. That is the MCQ. Okay, so when you evaluate the Mantoux test, answer is 48 to 72 hours. Okay, so this is one part of the MCQ. Another one part they have already asked are this one, how much the induration should be. Okay, if it is more than 5 mm, it is positive for HIV positive patients. Okay, recent contact with active TB patients, and organ transplant and nodular or fibrotic changes on chest X-ray patients. Okay, it's more than 10 mm for children's, okay, infant, okay, who are high risk group like us. Okay, we work in wards, right? So we are in high risk groups, IV drug users. Okay, we have, if suppose they injected and it is more than 10 mm, we are said to be positive for Montex test. And as a normal public, they are positive if the induration is more than 15 mm. Okay, so this has many times they have asked, okay, for HIV positive patient how much should be the induration, for IV drug users how much should be the induration, for children who is of 3 years of age how much should be the induration, like that many times they have asked. Okay, so please clear with this point also. 5, 10, 15. First 5 is for immunocompromised, and 10 for high risk people and children, and for 15 is for normal people. Okay. Next MCQ. Shelf life maximum storage time of PRBC is 42 days, 40 days, 35 days and 30 days. Okay, they have asked the maximum time. Okay, so please read the question very well. They have asked maximum life. Okay, so the answer is 42 days. Okay, so usually the transition period is 35 to 42 days. Okay, so if they ask shelf life storage time of PRBC is, you might have chosen 35 days also. Okay, that's also right, but the question is specific on maximum number of days, so the answer is 42 days. Next MCQ, what is the complication of blood transfusion? Option A, hypokalemia. Option B, hyperkalemia. Option C, hyponatremia. And option D, hypomagnesemia. Okay, so a patient is on blood transfusion. Okay, what electrolyte imbalance occurs? The answer is hyperkalemia. Okay, if the patient is on blood transfusion, potassium level may be increased. Okay, and calcium level will be decreased. Okay, this also MCQ have came. Okay, hypercalcemia and hyperkalemia are associated with blood transfusion. Okay, so next MCQ, humoral immunity is transferred through T cells, B cells, alpha cells, beta cells. Okay, what is immunity? The ability of our body to protect, okay, against pathogens. Okay, so it's of many types. okay, active immunity, passive immunity, okay, natural immunity and acquired immunity. Among the types, one more type is humoral immunity and cell mediated immunity. Okay, so among that, what is humoral immunity? And it is transferred through, answer is B cells. Okay, B cells are matured in bone marrow, that's why they given as B cells. T cells are matured in thymus, okay, that's why they given as T cells. Okay, so in humoral immunity, what happens is, suppose a antigen, okay, a pathogen is entering our body. So once the antigen is entered in our bloodstream, so what happens is, our neutrophils will go and attack first, okay, then second thing is monocytes go and engulf the bacteria or virus, whatever the antigen presents, okay, so that is known as phagocytosis. Okay, so before entering into that phagocytosis period, okay, our B cells will go and affect the antigen. Okay, so it will produce plasma cells and memory B cells. Okay, so that is known as humoral immunity. What is cell mediated immunity? That engulfs the bacteria, then it produces it will assess the bacteria's this one cell wall, everything, and structure everything, and then it will produce the antibodies. Okay, so to be more precise, okay, humoral immunity are generated extracellularly. Okay, means when the antigen didn't enter the cell itself, the humoral immunity will be produced. Okay, whereas cell mediated immunity are produced intracellularly. Okay, so once after the antigen enters the cells, then only it is produced. Okay, so next MCQ, which immunity is affected in HIV disease? Option A humoral, option B cell mediated, option C natural, and option D passive. Okay, so the answer is cell mediated. Okay, so I have already discussed what is cell mediated. Okay, so in HIV, what is HIV? Immunodeficiency virus. Okay, it will affect our WBC. Okay, in WBC specifically, it affects the lymphocytes. Okay, which lymphocytes? T lymphocytes. Okay, so that's all about today's video. So if you love our video, subscribe our channel and like our videos and share our videos among your friends. Okay, thank you guys.